Tom. It's good to see you here.
Thanks, Kevin.
We've known each other for quite a while. I've known you my entire urology career. You taught me how
Yes.
to hold a cystoscope.
You've mentioned that.
Yeah.
Yeah.
We're here at Florida Urologic, and a wonderful place to be. I think we have a lot of really highly motivated people here to promote urology, promote education. And so, what does it mean to you to be here at this meeting today, with having your long career being associated with FUS, Southeast Section, and also a Gator?
Yeah. Well, it's always been a great meeting, and it's always been one that the residents could really connect to. I mean, I remember having done my residency at the University of Florida. Some of my early memories of organized urology was the Florida Urologic. And some of my mentees, kind of reinforced how important it was to be involved in organized urology. FUS being, kind of a stepping stone to the section and into the AUA. And in many ways, I've emulated some of my mentors.
Yeah. And we know you've been involved here at the state level and Southeast Section, as you mentioned, AUA. How did that evolution progress from that upwards trajectory?
Well, I think local is often everything. And of course, our state Urological Association Society is very strong in numbers, strong in activity, strong in education, strong in influence. I actually started first with the Florida Medical Association, and it was before the days of specialty organization, and I just felt my efforts could be more productive within my specialty, so I kind of evolved to more involvement with Florida Urology, and that led to being a Florida section rep to the Southeast section, and involvement at the section through a litany of positions led to my AUA involvement, both as a board member and as an officer of the AUA.
We certainly know you've been doing a very very noble job of giving back and philanthropic efforts, and you've really done that at multiple stages, I think, of your career in different locations. Can you talk about how you've done that through your career currently?
Certainly. So when I finished my residency, I went into a private practice, a rural private practice. One other urologist. It was within striking distance of Gainesville, so I maintained as a I was a itinerant urologist in private practice. Came up and taught the residents surgical procedures. But we evolved that private practice into a group of 17 in 4 counties, and was one of the first large group practices, developed ancillaries, built surgery centers. But after a while, I began to realize that my best day of the month was my day with the resident in Gainesville, and so that became my second career. Yeah.
Oh, fantastic. And kind of a broad general question here, but what does the AUA presidency mean to you?
Well, I mean, I've been very involved in the AUA at multiple levels. And I think leadership is about service. And I felt that was really my driving force for the Florida Urologic, for the section, now for the AUA. The CEO of the AUA asked me recently if I was contemplating the AUA presidency. And I said, I think I am. And he said, well, that will make you the longest serving board member in the history of the AUA, because I've done 5 years, followed by 5 years as treasurer. So I wondered what that implied. And he says, well, I think that just implies dedication. And I think the dedication is to the service of our specialty and the service of our patients.
Certainly.
Yeah.
Oh, thanks, Tom. It's been a pleasure having you by my side in clinic and teaching me the ropes here. So I'm looking forward to this next step.
Yeah, and I remember your first day, like it was yesterday.
Try and forget them.
Yeah. So residency followed by fellowship, and back now as a valued co-faculty member and a member of the Eurogators. And I guess we could say a word about the Eurogators, which is our alumni. This was founded in 2007. I was the initial president and founding president and still president. We'll have to get one of you guys to step in. But we're in the midst of a campaign now to raise money through the residency alumni fund for resident education. And we're in the midst of what looks to be a very successful campaign.
Yeah. Fantastic.
Yeah.
Well,
Thank you for
thank you.
interviewing me.
Oh, thank you for being interviewed by me.
Yeah, it reminds me when I interviewed you for residency.
Yeah. Oh, how'd you let that one slip through?
Yeah, I don't know. I'm really proud of you as well.
Oh, thanks, Tom.
All right.
Yes.
All right.
I'm really excited for the next step here.
All right. Thanks.
Good to see you.